A very good afternoon to everyone. Welcome to today's session on Myonne OD, Infertility by Apollo Fertility. We would like to welcome Dr. Sunita Iliani to discuss today's topic. She's done her MBBS, MD in OBGYN, and a diploma in Advanced Reproductive Medicine. Shall we start, Doctor?
Yeah, yeah. Hi, Chetura. Nice to see you. Yeah,
Yes.
so today's topic is something very relevant to our infertility patients who are suffering with fibroids. And there are a lot of question and answers which we will go ahead and answer there, and hopefully they will get a clarity on this topic. Yeah.
Right, Doctor. So first question is, Doctor, what are fibroids?
Okay. So fibroids, in scientific terms, it is known as myomas. These are nothing but arising from the muscle of the uterus. There are smooth muscles in the uterus layer, the anterior and posterior wall. This is covered with muscle layer. So this, from the wall of this muscle layer, sometimes there can be benign small growths which start developing in some women, not in all. And these are nothing but smooth muscle growths. And these are benign. That means they are not cancerous, and these are very very common, and we do come across in the younger age group and also in the older age group, and in the older age group it is more commonly seen.
Right.
Yeah.
And what is the cause of these fibroids formation, Doctor? What causes the
Yeah.
fibroids to form?
Yeah. So the fibroids or myomas, no, we do not exactly know what could be the possible reasons for their appearance, but some of the things that we can understand is that it is probably related to the race from race of the woman also. See, we see more commonly these fibroids are seen in the African women, so race can also be influencing factor for the appearance of the myomas. It is also possible if it could be hereditary factors also can also influence the formation of these fibroids. So we normally see in the patients, either the sister or mother can also be having the fibroids. So it could also be a genetic factor also can play a role. And we can also see that sometimes if they have attained menarche at a very early age, or they have postponed their pregnancy for some reasons due to career or for some personal issues, they have not conceived over a long period of time, then also these fibroids seem to appear. So basically we do not know the exact reasons, but it could be genetic factor, it could be early menarche, and sometimes late menopause.
Right, doctor. And how do they cause infertility as such, doctor?
Yeah. So the first, I mean, a lot of our patients do have this query that once we tell our patients that you have a fibroid, they become really worried about it. So one thing they need to rest assured is that not all fibroids cause infertility. That's very important to understand. The Whether the fibroids can cause infertility or not will depend on the size of the fibroids which we see. It depends on the location of the fibroids where it is seen on the ultrasound, and it also depends on what was the how long the couple have been married and how long they have been trying. So depending on that, we consider whether the fibroids needs to be treated or not. So basically, if the fibroids are located very close to the endometrial layer, that is the womb layer where actually the pregnancy sticks, and sometimes if the fibroids are going into the endometrial layer and causing an indentation into the womb layer, thereby it is like something like a mass in the womb layer itself. If it forms, that is known as the submucous fibroids. These fibroids can cause problems for the patients, and they can cause infertility issues. But if the fibroids are just in the muscle layer, that is known as the intramural fibroids, these usually do not seem to cause much of a problem to the patient unless they are very big in size and probably pushing the womb layer to one side. That is, they are impinging on the womb layer. If that is the case, then probably we need to get treated. And if supposing the fibroids are very much away from the um womb layer. They are literally, we would say they are outside the uterine muscle, that is known as the subserous. Then these fibroids do not require any treatment, unless of course if they are very huge in size, then maybe we consider removal of those fibroids. So basically there are three types of fibroids we have: the submucous, the intramural, and the subserous. So supposing you have subserous or intramural, they do not require much of a treatment. But in case they are submucous, that is pushing into the your endometrial layer or the womb layer, then they can cause infertility issues, and they may require surgical removal.
Right, doctor.
And also, one more thing to add on to that, the size of the fibroids also matters. And supposing your fibroid is more than 5 centimeters, then also it is better that the fibroids are removed.
Right. So, do all fibroids need treatment, doctor?
So, as I said, if the fibroids are in a location where it can cause infertility, like in the womb layer, if they are present in the womb layer and impinging or invaginating into that womb layer, then in that case they need to be removed, because they can cause a problem in implantation. They can cause excessive menstrual bleeding, and also they can prevent the transport of the sperm into the fallopian tube. So these are the issues that can happen if you have a submucous fibroids, and they need to be removed.
The next question is, doctor, what is the problems patients face with fibroids?
Yeah. So, fortunately, lot of patients with fibroids do not seem to have any symptoms. That means they are asymptomatic. They routinely, when we do an ultrasound for some other routine medical check, sometimes we realize that the patient has fibroids, and they would be just walk in without any symptoms, and we would probably diagnose a fibroid. So these are patients who do not require any treatment. The few of the patients can have some problems, like they can have excessive menstrual bleeding during menstrual cycle. They can also have excessive pain during the menstrual cycle. The other thing is they can also have, if it's a very huge in size, they can have pressure symptoms. That means they'll have problem while passing urine. They may have frequent urination problem. They may have difficulty in passing urine. If it's very big in size, it may press on the urinary bladder and cause problems. It can also sometimes result in constipation or difficulty in passing motion, because it is so huge in size that it is could be pressing on the intestines also. So these are some of the problems that the patients face if they have fibroids. But majorly they can be very asymptomatic, and if they are asymptomatic, they do not require any treatment. Because what happens is, once the patient achieves menopause, they seem to regress on its own, and when it regresses on its own, we don't have to worry at all.
Okay.
Once,
Is it
especially after menopause.
right? Is it possible to prevent fibroids as such, doctor?
Yeah. So there is no way we can prevent the formation of fibroids. There's no treatment like that where we can completely may ensure that the patient doesn't develop fibroids in the future. But studies have shown that women who are obese tend to have these fibroids more commonly. So, if it is important that patients have a healthy lifestyle, they need to exercise regularly, maintain their weight. This will probably decrease their chance of having fibroids, and also having good diet, vegetables, fruits, having healthy diet, healthy lifestyle does help in probably not exactly preventing fibroids, but at least some chance of probably not developing fibroids in the future.
Another question that we have is, doctor, does fibroids recur once after the treatment it's treated and it's gone? What are the chances of it recurring again and again?
Yeah, so that's a very good question. So, what happens is, once the fibroid is removed, there is no way that the fibroid will appear in the same place. But it is possible, if the woman has tendency to develop fibroids, they can appear in some other location. And it's also, we need to remember, the fibroids which are usually removed are bigger in size, say more than 3 centimeters in size. So if there can be possibility that they're very tiny fibroids, say about few millimeters in size, say less than 10 millimeters in size, say 5 or 6 millimeters in size, these cannot be removed when we are planning to do a surgical procedure because they're so tiny they are not be visible also. So these tiny fibroids can go and grow at a later point, say after a few years, they can become bigger in size. So it's not that the fibroids will recur at the same point, at the same place where we have removed it, but it is possible that they can appear and develop at some other location, and that can again may require removal at a later point.
Okay. Next question is, Doctor, when is surgery required for fibroids in infertility patients?
So, if the patient has submucous fibroids, then definitely surgical removal is required. That is, they are pushing the endometrial into the endometrial cavity. If the fibroid is very close to the womb layer and pushing into the endometrial cavity, then definitely we need to remove that fibroids. Those are submucous myomas, which we say. Also, if the patient has a very big myoma, more than 5 centimeters, and if it is intramural also, and it is impinging onto the endometrial layer or pushing the endometrial layer to one side, or if the patient had previous fertility treatment, say an IVF cycle, and did not conceive, then it is worthwhile removing those fibroids also, even if they are not submucous in nature. They are just in the muscle, but if they are very big in size and probably pushing the endometrial layer to one side, then also, or if they had IVF cycle and they did not conceive, then we may recommend a removal of the fibroids. And
Okay.
of course, if the patient has symptoms because of fibroids, then again you need to get them removed.
Right. So, how long does it take for the patient to recover post fibroid surgery as such, Doctor?
Yeah, so usually these fibroids or myomas can be removed through laparoscopy itself. So the good thing about a laparoscopic procedure, removal of fibroids, is the patient can get admitted in the morning and they can leave in the same day in the evening. So it's a like a daycare procedure. It can be completed. So that means, and even the laparoscopy, the advantage is the patient recovers very fast, and they can go, they can go back to their work probably in a week's time, unlike in a open surgery where the recovery is much longer. So if the patient undergoes a laparoscopic myomectomy, then the recovery is much faster, probably within 1 week. Unlike an open removal of the myomas, then the recovery can be longer. And post removal also, the patient at least they should not be planning to conceive for the next 6 months, so that the muscle layer of the uterus heals, and the patient will not have any complications in case she becomes pregnant. So at least a 6 months period the patient should wait before planning for pregnancy.
So, immediately after the surgery, can one, doctor, is there any lifestyle changes that they should adapt for some time, or could they directly go into their usual routine of, exercising or walking? Would that be normal after
So,
surgery?
it again depends from patient to patient. There are it depends on how well they recover from the surgery. Some of them they seem to recover faster and they immediately can get back to their uh, routine life. But some of them tend to take a little longer period. As I said, if it is done by laparoscopy method, the myomas are removed, then the recovery is much faster and they can go back to their routine, whether it is exercise. Uh, yeah, they can get back to probably in a week's time or 10 days time, they can get back to their routine life. But if you're talking about exercise, then probably it's better worthwhile waiting for at least 3 to 4 weeks before going planning to exercise and all that.
Okay. Does the laparoscopic surgery, doctor, post that, are there any side effects, or does it kind of stall a person's usual routine for some time, or uh, not
Okay.
really?
So, laparoscopic surgery is quite safe. There are no major side effects with the procedure, but as in any surgical procedure, there there is a risk of anesthesia, risk of intraoperative bleeding, risk of injury to the organs which are located close to the uterus is all a possibility, which is very, very rare, maybe 1 in 1 lakh patients. So, usually, patients do not seem to have any side effects after myoma removal.
Okay.
And of course, I'm talking about the period. Intra period, usually it is quite safe procedure and it can be done with a very well equipped and theater and a skilled lab surgeon. It is a very safe procedure. But post surgery, also patients do not seem to have any side effects. It is uh, very safe, and patients can go back to their routine life also post surgery.
Uh, Another question, doctor, is what happens when one plans not to go ahead with the treatment? Is it all right for the fibroid to just stay and not get treated? If a person is not comfortable with going into laparoscopic surgery, is it still all right for it to just stay there, and what problems that might eventually lead to?
Hmm. Yeah, so as I said, not all fibroids require treatment. If the patient is not having any symptoms because of the fibroids, then no need to go for a surgical removal of the fibroids. But in case the patient seem to have some symptoms because of the fibroids or excessive bleeding or pressure symptoms, then surgery is advisable. But if the patient seems to be very close to the menopause stage, and in those patients sometimes they can opt for medical management of the fibroids, where the medication can suppress the fibroids size and also the symptoms which are associated because of the fibroids. And once the patient attains menopause, then a patient need not worry because the size itself will regress on its own. So if they're very close to menopause, medical management can be an option. The other management for fibroids is there are other techniques like you have what is known as uterine artery embolization is there, and also there is one interventional radiological procedure where ultrasound rays are used in order to decrease the size of fibroids, which is known as the HIFU. Now, HIFU and the uterine artery embolization methods are also an option in women who do not want to opt for laparoscopic removal of the myoma, where they do not want to go for surgery. These are the other methods where it's not done surgically. It is a radiological procedure where under the visualizing the fibroids, the interventional radiologist will probably stop the blood circulation to the fibroid so that it shrinks in size, and also sometimes high frequency ultrasound rays are used in order to shrink the fibroid. So these are the other options that can be considered if the patient does not want a surgical procedure. But these are not done in all the centers. There are only few centers who do these procedures.
Right, doctor. The next question is, doctor, when can they plan pregnancy post surgery?
Patient has to wait at least a 6 months period before they plan for the pregnancy.
Pregnancy. All right. The last question, doctor, before we conclude today's session is, doctor, does fibroids affect egg quality?
No, fortunately, fibroids do not seem to affect the quality at all. Unlike the other conditions like your endometriosis, which can affect the quality, fibroids do not affect the quality at all. And also, one more thing here I wanted to add is, in case the patient for supposedly becomes pregnant and she has fibroids, then also usually patients do well during pregnancy. They do not have any problems during the period of pregnancy. Very few patients can have pain or sometimes labor pains much earlier than the expected date of delivery, that is preterm labor. Very few patients can have these problems during pregnancy, but most of them tend to do well and they do not have any problems during the course of their 9 months of pregnancy.
Thanks a lot, doctor. So that was the last question, doctor.
Yeah.
Would you like to tell anything before we conclude today's session, doctor?
Yeah. So, what we have observed in the clinic is lot of patients tend to get very worried about this fibroids, uh, and when we just tell them in a routine ultrasound when we do for an infertility couple, and we tell the patient that yes, you have a fibroid, which is about say 1 centimeter or 2 centimeters, they immediately get worried and they say, is that a cause of concern? So here I would like to tell the patients, see, not all fibroids need treatment. Many of them do not need treatment at all, and they do not seem to cause infertility. Many of them can conceive on their own or with some assisted reproductive technology, and only few patients require removal of the fibroids, and these are very few patients, not and 90% of them do not require any treatment for the fibroids, unless if the size, and depending on the size and the location, the doctor will suggest whether you require treatment or not. Yeah.
Okay. Thanks a lot, doctor. That was very informative session. Thanks for answering all our
Thank you,
questions.
Shitra. Thank you for conducting the session, and look forward to many more sessions like this. Yeah.
Thanks a lot,
Thank
doctor.